masks, social distance, and practice COVID-19 safety measures. The WHO says highly contagious variants are spreading in several countries. The Wall Street Journal reports about half of adults infected with the Delta strain in Israel were fully vaccinated with the Pfizer shot. The United States has largely ended mask mandates and other restrictions as vaccines reduce infections and deaths.
Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor. With the prevalence of Delta, is it your thought that we should continue wearing masks, or some percentage of the population should be wearing masks?
Well, certainly people who have any kind of immunocompromised condition should be wearing masks now. This may have even been true before. But the difference with the WHO recommendations and CDC is WHO is really dealing globally, where vaccination rates are minuscule, like such in Africa, less than 1%, up to, nowhere close to what we have going on here. So our situation here is a little bit different. In that we have a lot more people vaccinated. So, we should follow the CDC guidelines, and they have not put that mask mandate into place.
Let's talk about this CDC warning about a little over 4,000 people have been hospitalized or died with COVID after getting the vaccine. I think when people hear that, it worries them. Put that in perspective if people are worried about that.
Right. Remember, these vaccines are not 100% effective. They're about 90% effective against the Delta variant. And the Delta variant has gone from a couple weeks ago, 4% to 10%, now to 20%. It will completely take over by August in the United States. It's highly, highly transmissible. The vaccines are 90% effective. That means 10% is not going to work. And fortunately, it is preventing severe hospitalizations, ICU, and many of the deaths compared to unvaccinated. Compared to unvaccinated, it's a disaster. Look at Australia. There are very few people in Australia are vaccinated, because they had such good social distancing and all that stuff, and isolating cases. But now they're popping up cases in many dozens, and they've locked down several big cities.
All right, let's take a look at questions. With the virus mutating, do you think we will need booster shots later this year?
Yes, I do. And it's been stated by the head of the NIAID, Dr. Fauci, and also the CEO of Pfizer and other public health officials that, boosters are most likely coming.
All right, next question. Should our out-of-town family who have recovered from COVID and recently tested positive for antibodies still take precautions masking in public 10 days before visiting us? They do not want to get the vaccine, and we have a young child who is too young to be vaccinated.
Well, if they don't want to get the vaccine, they are putting your family at risk. Before the Delta thing, you could say, okay, you're protected, nothing's going to happen. But things have changed in the last couple of weeks. And, these people, if they refuse to take the vaccine, even though they've had COVID and they have some protection, it may not be against Delta. It's very high risk to have them come visit. They really shouldn't be visiting.
Thanks, Dr. Murphy. Well, if you did not get your question answered by the doctor, beginning tomorrow, Dr. Murphy will answer questions bi-weekly on Northwestern University's Institute for Global Health Facebook page. And you can also submit questions via email at globalhealthinstitute@northwestern.edu. And you can also post them on our Facebook page, our Morning News Facebook page. We'll talk to Dr. Murphy again on Friday. Have a good week, doctor.
Thanks, doctor.
Thanks, Peter.
Hey, Morgan.
Thank you.
Hey, you guys, let's